We often talk about gun deaths, but from your perspective, I'm sure there isn't a weekend that goes by that somebody isn't reported as having a non-life-threatening
injury. Yeah.
Gun injury, because that's a public health problem as well.
100%, that's a great point. So one of the really interesting things about guns is that for most injuries, we talk about there being an injury pyramid, where there are thousands of injuries that never make it to the ER, hundreds that come to the ER and get discharged, dozens that get admitted, and then for one that dies. For firearm injury, it's basically a one-to-one box. So almost everyone who gets shot comes to an emergency department or dies in the field. And it's about a one-to-one ratio, it's about a 2-to-1 ratio of those who get injured and survive versus those who die. It has such a higher fatality rate than any other type of injury. That said, you are right. For every death, there are about 2 injuries. And one of the things that has always struck me as crazy is that we take care of these patients and then just send them out to the street. So I took care of someone, all right, I'm going to be careful because I always have to be careful about HIPAA. I've taken care of many patients who have had a graze wound or have had a something that doesn't require a hospital admission, who are absolutely scared to death at the moment of their injury. I take care of them, I make sure it's not life-threatening, they don't need to be watched overnight, and I send them home. I don't provide them with psychological services, I don't provide services for their family. I don't talk about the ramifications for PTSD for them and for their community. I don't talk about their hopelessness that they're going to feel, the likelihood that they may use substances to deal with the terror that they're experiencing afterwards. The fact that there's a higher rate of retaliation after a first injury because you're scared and angry, right? We don't do any of that. And so the ripple effect of these injuries is huge. And I think, it's been highlighted in the past couple of weeks with the 3 suicides, the 2 Parkland students, and then the Jeremy Richmond, the father of Abiel, who they started the Abiel Foundation, showing the degree to which you don't even actually have to be injured by a bullet in order to have it affect you forever. That's a great question. Thank you.
I'm a psychiatrist, and I actually did consultation liaison at Rhode Island Hospital a while ago. So I'm confused because we used to be called in on cases like that. So why don't they do it any longer?
So we do call social work. So you're talking about for the firearm injury? Like someone
for everything, even if it was a suspected suicide attempt, like a car accident.
Or I was even a domestic violence. I would have thought they would have had somebody refer them to a sojourner house somewhere.
Absolutely. So we have social workers on call 24 hours a day. So every firearm injury gets a social worker involved, including the domestic violence patient. The story that I told, there was a social worker involved with a case, but there were still limited resources. And at that point, there was no ERPO law in the state, right? It was not her spouse. Besides, there was no conviction, right? So there were all these things that made it so that there was no way to say that this man, she hadn't even filed a restraining order yet at that point. So there were a lot of factors involved with that. We absolutely consult psychiatry for every suicide attempt, but I'll be honest, our psych volume is so high that our emergency psychiatrists can barely keep up with the acute suicide attempts, acute mania, etc., much less with the things that will have long-lasting ramifications, but are not an acute emergency today. And I should say there that actually a lot of my own funded research, a lot of the stuff that I spent, thank you so much. I appreciate that. Thank you. A lot of the stuff that I personally research is about how to bridge that gap. I have ongoing research with text messaging programs for teens who've been in physical fights to try to reduce depression and anxiety in future fights. And we have another program that's ongoing around cyberbullying as well. So it's a great, so there are definitely protocols, but they're
overwhelmed.
They're overwhelmed, yeah.
So we just need a greater staff.
We need a greater staff. We also need better guidance. I think you guys are amazing at the emergency psych services are amazing at the high-risk patients. And you're really great at the lower-risk patients too, but then you see them and it's like, well, I need to see, right? It's a one-time touch. And then it doesn't deal with a
It's
long term.
triaging them.
Exactly. And we all know the lack of mental health resource. I mean, that's a whole different discussion. That's a whole other topic, yeah.
Maybe oh, sorry.
Oh, sorry.
Go ahead.
Or is it in the back and then Lisa, yeah. Yes.
I might have completely missed this, but you mentioned, you said you need education, engineering, and enforcement. I understand what the first and the third are, but what do you mean by engineering?
So great. So in injury prevention in general, we think about ways to make the chance of injury lower or the lethality of an injury lower. And so examples include, I'll talk for non-gun examples. So hair dryers. Right? When I was growing up, my mom was always like, don't use the hairdryer near the sink because if the cord falls in the sink, you're going to get electrocuted. Well, now we have the ground fault interrupters, right? So that you can't get electrocuted even if your hairdryer falls in the sink. That's an example of engineering. Another example is with cars, the fronts of the cars crumple now,
Right.
which absorbs energy so that there's less likelihood of that energy being transferred into the person who's in the car. With guns, it could be things like smart guns.
Right.
Right, so
Sensors?
exactly, like having the biometric sensors
Right.
so that your kid, so most kids who commit suicide with a gun generally do it with a family member's gun. And so if we had a biometric sensor, then the kid couldn't go and get into their parents' gun safe and take the gun and shoot themselves. Right, so that would be an example of a type, and there may be amazing ideas that I've never thought of also, right? So I am not an engineer, but like, you know, yeah, it's a good question. I think she was going to ask a question, then I'll go on.
Yeah, I was just curious, a firm, it's a national organization.
Correct.
Are you seeing a lot of participation from a lot of ER doctors? Are they
Yeah.
having the courage to kind of come forward and talk about this as a public health issue? And also, do you get involved in partnering with like medical societies?
Yep.
Do they get involved to
Yes.
help you with like your voice?
That is a great question. Yeah, so we actually have 17 medical societies that have partnered with us, ranging from the American Medical Association, American College of Surgeons, American Psychiatric Association, Emergency Nurses Association, the American Association of Family Practice, American Academy of Pediatrics, et cetera, et cetera, et cetera. So we have almost every major medical organization in the country that has partnered with us and has committed to promoting both promoting a firm, but also helping us to provide resources that are appropriate to their membership. We have had we have over 40,000 individual physicians who have kind of signed on and kind of joined in, and we have a number of events going on at medical meetings across the country. We actually just had a summit in Chicago in February with 40 different medical organizations taking part. It was held at the American College of Surgeons headquarters. So there is kind of a growth in that voice, and that's really our goal, is to kind of mobilize.
So do you lobby? Do you
So we
go
are a
to
five, no, so we are a 501c3, no lobbying at all. It is about kind of raising awareness, changing the voice, and then creating funding for research and education.
Gotcha.
Yeah,
You can't advocate,
we can advocate, but we can't
lobby.
lobby. Yes. Yes. I think he had his hand up first, and then I'll go to you.
So I actually had a follow-up to the previous
Previous
question.
about engineering. Yeah.
So, I mean, the thing is, you know, with automobiles, they get safer every year, but the automobile industry
Resisted
is
it.
cooperative.
Well,
they're
so-
cooperating
now.
because
So-
they've come to see it as
Right.
in their best interests
Mhm.
to make their cars safer. But at least where we are right now, a lot of these engineering problems have already been solved.
Right.
But we can't get the firearm industry to implement them.
Yep.
Because they look at it and they say, our customers don't want this.
Mhm.
They're looking at like very macho customers
Right.
who want something that, they don't want to put their thumb on it like you put it on an iPhone.
Right.
And
Totally. So that's a great question. So so a couple things. So one is that the automobile industry did not welcome seatbelts and airbags with open arms,
Sure,
right? Like
yeah.
that was Ralph Nader's. Whatever you think of him now, he did a lot of good at one point. with advocating. I mean, that was his life's crusade, was getting seatbelts in. And car manufacturers put seatbelts in, kicking and screaming, because people loved their beautiful cars, right? And they loved those steering wheels. And I'll look at those of you that, I mean, I was a little kid in the 70s, so I don't, but you know, like that was not, they were not thought to be as aesthetically pleasing. It was a big fight. And there were a lot of forces that created change there and got to, you know, part of it was the federal government saying that they kind of making, so that there were a bunch of things. There was federal government involvement, there was research funding, there were lawsuits, there was lobbying, there was science. There were a whole lot of different things that got car manufacturers to agree. And now we're at the point where car manufacturers kind of compete to see who can make the safer car, right?
Yeah,
I bought a Subaru because they're a really safe car, right? And that just wasn't a thing. I mean, that wasn't even talked about 40 years ago. You look about drunk driving, same thing, right? The fight to make drunk driving not acceptable was a long one. And it was thanks to community groups like Mothers Against Drunk Driving and these sorts of stories that made a difference. So I don't know if that helps. I mean, it's none of this is quick,
it's
right?
helpful, but
Yeah.
you know, one of the things about automobiles is a lot of there's a much broader category of people who are buying automobiles than buy firearms.
I mean, so it's interesting. So one of the things that I actually strongly believe is that, and I not only believe, I know to be true, the vast majority of gun owners are safe people and own guns. I mean, so my co-founder of a firm is a gun owner. He's an emergency physician. He owns a farm. He has to chase away coyotes. They don't get his sheep. He finds target shooting therapeutic. But you'd better believe that his guns are locked up and that his ammunition is separate. And I think that there is a way to recognize that we all across the country have different cultures in our cities and our towns, and we all have different practices. And just like, you know, the way that my family celebrates holidays might not be the way that your family celebrates holidays, I think recognizing that there is a really, that gun ownership is central to the culture of a lot of folks across this country, and not demonizing it per se is important and is a way forward. I think everyone, and one of the things that I've been really heartened by as I do this work, is that just about everyone, with maybe 10% on the fringe, agrees that we need to keep guns out of the hands of people that want to hurt themselves or others. And the question is, how do we do that? How do we do that better, right? And I think that part of it is being able to create spaces where we can have those discussions where we're not demonizing each other, where, and I certainly know that kind of giving the testimony on the Hill, you're seeing one part and one segment. But around 30%, depending on the survey, around 30 to 40% of physicians are gun owners. And I think it's important to, some of the stuff that I'm most proud of that we've done has been inclusive, right? And we're never going to solve this problem without making sure that we're working with folks from kind of both sides. And now I know that it takes two sides to tango, right? So, but I've been really heartened by the response. Yeah.
These guys in the yellow jackets are really nice guys. The ones that come to testify.
Some, yeah.
Some of them.
Yeah. I mean, so Jim Manny, who is I would follow Jim to the ends of the earth. He is one of my favorite people in this state, I will tell you. And, right, like, it's a great example of, like, to him, Gunner, like, Dee Goldstein and I went shooting with him. And for him, going to the gun range is meditative. It is his therapy. It's his moment of putting everything else aside. And I think that kind of recognizing that can help us to make forward progress, hopefully. Yeah. that was a long distance from your
That's
question.
great. I mean,
Yeah.
I think, we still have to grapple with that. It's a big problem.
Yeah.
It's really a big problem, and I think that you're absolutely right, that it needs to be addressed in a multitude of ways. Just legislation won't do it, just public advocacy won't do it, just education won't do it. It's got to really be a
bigger
multifaceted approach.
Yeah, and this is a horrible analogy, but it's really, there's no magic bullet, right? Like, it's like, but like there really isn't, yeah. But you were gonna say something, I'm sorry.
Well, my question is, part of it, I think your answer, is this a time to get a move to overturn the law that says you can't have research on guns?
It's a great question. So interestingly, so if you actually read the Dickey Amendment, which I'm not a lawyer, but like now I've done it. So it actually says that no funds may be used for the CDC for advocacy for gun control. So it actually doesn't forbid research. The trouble is that there have been no appropriations. It actually doesn't forbid research per se. It could be done under the Dickey Amendment. The trouble is that there have been $0 appropriated to the CDC. So the trouble is more of the political will to say we want to spend money on this rather than the Dickey Amendment per se. Does that?
Forbids federal money.
From being used for gun control advocacy. And I would argue that science is not advocacy.
Or for research.
So it actually doesn't say that federal money can't be used for research. It says that federal money can't be used for doing research on advocacy for gun control or advocacy for gun control. And so although it was used at the time that it was passed, they took all the money away from the CDC that they'd been spending on research. In reality, it doesn't forbid research. It's just that ever since that was passed, Congress has refused to appropriate funds to CDC for firearm injury research, and then everybody else has been too scared, with a few exceptions.
So can I just interrupt 1 second? I
Yeah.
just want to, I don't want you to stop, and we still have about maybe 10 more minutes for some questions, but while you're still sitting here, I just want to ask you if you can, there's these cards on the table that go to the Speaker of the House and to the Senate President. While you're just sitting here listening, very aptly, if you could fill them out so that we can hand them back to us so that we can collect them. Yep, and you can, if you want to take some, that's fine, yep, and we just want to get those done. So maybe if we have about just maybe 2 or 3 more questions, and then, that would be
Perfect, yes. And I apologize, I don't know everybody's names, so yeah.
I really want to thank you. One, for what you do. I'm a retired social worker.
Thank you.
I worked at the Providence Center, and there was a time where I worked in the emergency room covering mental health on a rotating basis. When we had to do that, it was so stressful. I can't imagine how you do that all the time. So thank you for that.
Well, thank her too, but I apologize, I don't know your name, but over with the emergency psychiatrist here, yes.
I also want to thank you for kind of revitalizing me, because after going, as many of us have, to the State House and seeing so many, yellow shirts, it's very discouraging. And coming tonight and hearing, about the Picanos and hearing you speak has kind of reminds us why we're here.
Thank you. Thank you. I hope I can keep doing that. So, thank you. And thank you for being a social worker too.
The Dickey Amendment is similar to what happens with the Second Amendment. It's misinterpreted for people's own reasons. I mean, the Second Amendment doesn't say we can have wholesale, artillery that we can task for. So I mean, we haven't been vocal enough to try to educate people as to what about those things really say, and then have some people who have enough courage to kind of just run with us.
Yes, I think interpretation is everything, and I think right now our society is not doing a super great job of nuance. So, yeah.
Could you just answer Lily's question
Oh,
right
I'm
there?
sorry.
And I want to just give Lily a shout out because Lily is a Brown student who started her own organization, Thoughts, Prayers, Actions. She's been working with us since last year, and she comes to everything. She was at the hearing the other night, testified almost at midnight, around 11:30 or whatever. She was very late. She was in a room of probably 20 older men in yellow shirts that were kind of tough looking, and she just sat there and she was poised and she testified, and she started her own organization. She's been working with us for a long time, and she comes, I don't know how you get your work done. I hope you're getting your grades up. You're always with us, but I just have to thank her for all that she's done. And she actually had a really nice conversation the other night with some of the people that were waiting to testify in the yellow shirts. And she's just, I think that if we're going to change the conversation about this, that Lily's one of the people who's going to help us do that. So please ask your question. I wanted to make sure you got a question.
Thank you so much. That was really sweet. Yeah, so this might be something where I can come talk to you later, but I guess I was wondering, because I've been trying to do some research, look at some readings to see what research has been done, and I was surprised that there has been some. I mean, it does make sense with the legal context, but I've really struggled to find good information out there about gun violence and mental health. And I was wondering, given the limitations, how do you actually go about doing that research, and what interventions can be done considering the mental health components, as you were talking about with suicide and things like that?
Yeah, that's a great question. So a couple things. So one is Tracy, who again unfortunately can't be here, is working with us at a firm to put together kind of a bibliography of best resources on firearm injury, like what's the best research that's been done, and then to summarize it in an easily digestible way. So we have a few of those done and more to come, and I'm happy to share those with you, and I'm sure she would be as well, and happy to get you involved too if you're interested. It takes all of us. And then in terms of kind of best practice, so there's a smattering of research that's been done here and there. There's some work being done around partnerships with gun shops and around screening for suicidality and referring people, which has been super promising. There's CALM training, which is like a lethal means counseling for patients who are at risk, which has had some positive results. There's obviously violence intervention programs. I'm a big fan of ISPN here in Providence, and there's a national network of hospital-based violence intervention programs, which has been tremendously effective because we find that so often community violence is tied to all of the underlying social determinants of health, and it's not ultimately about the violence at all, but it's rather about getting adequate treatment of PTSD and getting access to education and jobs and things like that. So that's a great example. There's also been some preliminary work around domestic violence. But to answer your question of how we do research despite the lack of the funding, and there's just not a lot. So I actually just finished a paper today that I was writing with colleagues at a couple of other universities where we looked at the funding for pediatric research and looked at the number of papers that are published. And you can track, like when there's no funding for research, there's no publications, and then there's no evidence on which to base things. It's like almost a linear relationship, right? And so the stuff that has been done, some of my colleagues have funded it themselves. That's what I've done. And then that's where kind of foundations really come in and help make a difference now. Yes?
Maybe it's not the correct question to ask, but it's a phrasing of it. But
okay.
In terms of on a town level, I know we talk about a lot at the state level, when you patent state laws and state legislation. What do you think is something, maybe one or two things offhand that towns could be doing better, like on a city level, like say here in Cranston, to try and both better advocate against reducing gun violence, but also trying to go towards the goals of what your organization is trying to do?
Thank you. That's a tough question. I think especially here in Rhode Island, we're such a small state. It's like, the line between, I live in East Greenwich, right? Like the line between EG and North Kingstown is like kind of complex and difficult to figure out sometimes. So, I think on a town level, I think that there's the work of identifying who are victims of gun violence in your state, in your town, and thinking about if there are kind of pockets that need attention. There's been a lot of work done on the state on youth suicide prevention that's been led by the Rhode Island Department of Health, and I think there's additional work there. I also think we're working with the Attorney General to try to create guidelines for providers around what they can do. And so that's something that certainly we could use help on a town level. The other stuff, the policy stuff, I will defer on simply because I just don't know all the individual town policies and I wouldn't want to say something out of turn. But then, you know, and then in terms of kind of supporting, certainly feel free to check out our website. And yeah. So.
And everybody that signed up, we'll send an email out with you, so we'll put the, we'll list the contact information there. And just two other things on the cards. I just picked them up. I didn't look at them. It says name and then it says school for some reason instead of address. So if you want to just put your street address instead of your school, since I don't think many of you, except for maybe one, are in school. But it is important to put your address on there just so people know that, like, if we give them to somebody, they'll know that you're in their district. So if you can do that. And then just on your sheets as well, there's a mistake, a typo on the weekly lobby day. It's the April 10th and the 13th. We lobby every Wednesday at the State House. Kat and I are there every single Wednesday around 3 o'clock. So if you want to come and lobby, Lily's been there many times. Some of you, Charlotte, some people have been coming on a regular basis, but please come. Nan?
We just noticed some interesting dates for the...
Yeah, I just said that. Yep, I just said that. Thank you, Nan. Why don't we just take maybe 2 more questions, and then maybe Tom, I guess.
Mine wasn't a question, it was a response to Rhode. I think local school districts, and I think this is what the foundation tries to do, is social emotional education. You know, I've worked for many years with 6 Seconds, an international organization on emotional intelligence, and the curriculum is fantastic, but we have to make it a concerted effort. It has to be a solid program. It has to be well integrated.
Yeah, well, and I'll say that was one of our recommendations from the governor's work group, was kind of improve funding for schools, both for mental health support services, but also for programs like social emotional learning. I think that's a great point, is kind of what you can do on a school committee level. I think we have 2, do you want? Yeah. I'll let Linda.
No.
Okay. Why don't you go, sir?
Okay.
Yeah.
What kind of research are you working on?
Me personally, or a firm in general?
Oh, a firm in general.
A firm in general.
Yeah.
So a few things. So one is collating best practices for education of providers across the spectrum. So what is it that psychiatrists need to know? What is it that med students need to know? What is it that emergency physicians or trauma surgeons need to know? And then disseminating that. There's no education about firearm injury in medical schools right now. So people go, none, zero.
If they know people are going to get shot.
None. We learn how to save people after they've got shot, but we learn nothing about how to prevent it. And you think about the history of domestic violence, we had no education about how to screen for or prevent domestic violence either. So that's kind of one of our big pushes, is kind of what is it that we need to teach and what's the most effective way to teach it, and then getting it out there with our partner organizations. We're doing research on best practices for counseling suicidal patients. We have one grant, which I actually have to review. We have a grant opportunity that's out right now for emergency medicine that we have a number of applications for, about what are best practices in the ED for taking care of patients. And then we're in a fundraising campaign right now, which at the end of it will be funding studies to do predictive analytics. So using like electronic health record data to say who is at risk and how do we identify them. Adam Lanza had been seen in an ED a few weeks before in Newtown. The Navy Yard shooter was in an ED here in Newtown. The Santa Cruz shooter had been seen. I mean, I can list all of, I mean, there's a few that would have slipped through the cracks, but almost all of these folks are seen by a provider in the weeks before something really bad happens. And my co-founder of a firm has amazing stories about Vermont, interestingly, has the highest rate of mass shootings in the country, partly because it's a small state, but also because there's so many firearms and because there's a whole lot of reasons. But he has single-handedly identified 2 folks who had plans and intervened. And he's just a super smart guy who has really good instinct. But how do we make that possible for physicians across the country? Right? Imagine, you know, we're not going to stop everything, but we can stop a lot.
Right.
So those are examples.
Well, I just want to thank you so much, and I want to thank Lisa so much.